Hello everybody, I'm Dr. Waqas. Today we are going to talk about erythropoiesis. So what is mean of erythropoiesis? It is the process of origin, development and maturation of red blood cells, erythrocytes. Erythrocytes. So I will talk about what is mean of hemopoiesis. So it is the process of origin, development and maturation of all the cells of the blood. For example, red blood cells, white blood cells and platelets. So, so first of all, we have to discuss site of erythropoiesis. Site of erythropoiesis. So, in site of erythropoiesis, first of all, we have to discuss fetal life. Fetal life. Students, the process of erythropoiesis in fetal life take place three stages. First is mesoblastic stage. Second is hepatic stage. And on the third is myeloid stage. So the process of erythropoiesis in fetal life take place three stages. First is mesoblastic stage, second is hepatic stage, and third is myeloid stage. So in mesoblastic stage, students, during the second month of intrauterine life, the process of erythropoiesis take place in mesoblastic stage in mesenchyme cell. In mesenchyme cell of yolk sac. So on the second is hepatic stage. In hepatic stage, students, on the start of third month of intrauterine life, the process of erythropoiesis, the production of RBCs take place in liver, and also spleen and lymphoid organ. Sorry, and lymphoid organ involved in the process of erythropoiesis in hepatic stage. Then after that is myeloid stage. So in this stage, during the last 3 months of intrauterine life, the process of erythropoiesis take place in liver and also red bone marrow. So students, we discuss in fetal life the process of erythropoiesis take place in three stages. First is mesoblastic stage. So in mesoblastic stage, during the second month of intrauterine life, the process of erythropoiesis take place in mesenchyme cell of yolk sac. So after that we discuss hepatic stage. In this stage we discuss the process of erythropoiesis during the start of third month of intrauterine life. The process of erythropoiesis take place in liver and also spleen and lymphoid organ involved. So students, after that is myeloid stage. So in this stage we discuss during the last 3 months of intrauterine life, the process of erythropoiesis take place in liver and also in red bone marrow. So after that we have to discuss the site of erythropoiesis in children, newborn baby and also adult. So if we talk about newborn baby, children and also adults, students, In children, newborn baby, and also in adult, the process of erythropoiesis takes place in red bone marrow. Students, when the baby born, so in newborn baby, the value of erythrocytes is 8 to 10 million per cubic millimeter. So after that, in the growing children, in the growing children, the value of RBCs become low gradually, and finally in adult, the value of erythrocyte is 7.4 million per cubic millimeter. So students, after that we have to discuss the process of erythropoiesis in 20-year-old. So in 20-year-old, the process of erythropoiesis take place in long bones and flat bones. So after the 20-year-old man, for 23, 24 or 25-year old man, the process of erythropoiesis take place in membranous bone. Membranous bones. For example, skull bone, ribs, vertebra bones, scapula, and all the membranous bone. The process of erythropoiesis take place in after the 20-year-old man. So one thing is very important because the red bone marrow is the site of all the cells of the body. For example, red blood cells, white blood cells, platelets. So this is the site of all the cells of the body, red bone marrow. So red bone marrow produce 75% WBC and 25% produce RBCs. So, but the value of RBCs in the blood is greater than WBC. But here we are discussing and red bone marrow produce 75% white blood cells and only 22% red blood cells. But why the value of red blood cell is greater than white blood cells? So there is reason behind that. Stress because the lifespan of RBC is 120 days. 120 days. And the lifespan of white blood cell is 8 to 10 days. So because the lifespan of white blood cell is very low than red blood cells, so for maintain the value of white blood cells, because the lifespan of the white blood cell is very short than red blood cells, the lifespan of red blood cell is very long than white blood cells. So because the lifespan is very short, so to maintain the value of white blood cells in the blood, it produce a lot of white blood cells. Bone marrow produce a lot of white blood cells. So that's why the it produce 75% white blood cells, but yet the value of white blood cells in the blood is low than RBCs. So students, this was all about erythropoiesis and site of erythropoiesis. And next video we will discuss the process of erythropoiesis, how the RBCs form in the body. So all the process we will discuss in the next video, inshallah. So this was all about erythropoiesis and site of the